Hello, I am Dr. Hisaharu Suzuki, founder and director of Centurion Suzuki Eye Clinic in Kanagawa, Japan. I specialize in cataract and refractive surgery, as well as the treatment of ocular surface disease. Performing cataract surgery at relatively low intraocular pressures can help minimize the impact on ocular tissues. However, it may increase the risk of anterior chamber instability, particularly during occlusion break. To help maintain anterior chamber stability during cataract surgery, the Unity combined vitreoretinal cataract systems and stand-alone cataract system incorporates real-time sensing and independent aspiration and irrigation controls. Anterior chamber instability is most easily observed during an occlusion break event. Therefore, my colleagues and I recently conducted a comparative study to assess anterior chamber stability during simulated occlusion breaks using a slit side view method. We compared the Unity system and the Centurion system with Active Sentry. Simulated occlusion breaks were performed using both systems with 10 processing eyes each. The anterior chamber stability was assessed with the slit side view method, which uses a slit lamp microscope to visualize the movement of the posterior lens capsule. We evaluated both systems over a range of intraocular pressure set points and vacuum limits, while maintaining a constant aspiration rate. In comparison to Centurion with Active Sentry, the Unity system demonstrated a notable reduction in the average change in anterior chamber depth during simulated occlusion breaks, resulting in a significant improvement in anterior chamber stability by a factor of 2.8. Moreover, the maximum variability for any set of conditions with Unity was less than 1.4%, whereas the maximum variability was over 6% with Centurion with Active Sentry. The Unity system consistently demonstrated a significantly lower surge duration across all conditions compared to Centurion with Active Sentry. In fact, for all experimental conditions, the surge duration with Unity was 0.17 seconds or less. The mean surge volume was also significantly lower with the Unity system, regardless of intraocular pressure and vacuum limit conditions. Mean intraocular pressure at baseline was within 0.7 mm mercury of the set point was the Unity system and within 3.2 mm mercury with Centurion with Active Sentry. After occlusion break, the Unity system maintained the minimum IOP significantly closer to baseline compared to Centurion with Active Sentry. Using our slit side view method, we observed that the Unity system provided greater anterior chamber stability during simulated occlusion breaks compared to Centurion with Active Sentry. These findings suggest that cataract surgeons may feel more confident operating with the Unity system at lower intraocular pressures.